I'm Haley Taylor, and you're listening to the Rough Draft Diaries. On today's episode of the Rough Draft Diaries Under Quarantine, we're going to talk to individuals who can't stay in quarantine and head into work every day. We're talking to nurses.
It's like just the most rewarding thing I've ever done, even though that's really cliche, but it's true. It's when you see someone go from being so critically ill and then making a full recovery, it's just really rewarding.
That's Lindsay, an ICU nurse at St. Luke's Hospital, talking about why she became a nurse in the first place. Lindsay has been a nurse for about 3 years, so the COVID-19 crisis is an early challenge for her. A challenge that she and her close friends didn't see coming.
I would see it online in other countries. I feel like I don't really think we were expecting it. I don't want to say we're not prepared, but, there's shortages of everything, of masks, of protective equipment. My work is doing a really good job at, I feel like, trying now to get ahead of the issue, but there are a lot of patients who are, confirmed COVID positive or that they're under investigation for it. It's just really scary.
Especially scary for Lindsay, as she has seen firsthand what the coronavirus looks like in a patient.
They get very sick very quickly. They from what I've seen, the patients, they deteriorate really quickly, the respiratory issues, and there's not really a treatment for it. Just kind of managing them, trying to get them over the hump. So, and it's sad because they're alone. We're not allowing any visitors in the hospitals for, patients and for their sake. So they're really ill and have to be all alone, isolated in a room. I try to go in as much as I can just to talk to them or be with them, but also I'm trying to limit my exposure, which is hard.
The most obvious way to limit exposure would be through protective equipment like gloves and masks. But as Lindsay mentioned earlier, demand quickly depleted any stock available, and as many hospitals were experiencing this same shortage, ordering new equipment took time.
Now what we do have, it's locked away. I can't just get a mask if I want to. I have to ask my manager, and she has, got to unlock it for me. And we're reusing, we get one N95 masks, which are supposed to be for single use, and we have to wear that, every day. It's part of our uniform now, the same one mask constantly. And if it breaks, we're just tying it, stapling it, trying to keep it in working condition. But so I do worry about, having enough ventilators to take care of my patients. Or I've seen some articles where companies are, trying to come up with rapid testing, or they're making ventilators, or, and this is all very exciting. I just hope that we never get to the point where we need to, where we run out.
Speaking of testing, Justin, who works at a reference testing lab in North Toledo, has also experienced a race against the clock, as his lab was not initially approved to test for COVID-19. They had to send the specimen elsewhere to be tested, while trying as quickly as possible to find a local solution.
So we are currently sending all of our specimens to another laboratory that is local. So whereas when we first started sending these out, they were going all over the country. University of Washington was doing them, I think, other laboratories. That would take a few days at least, if not, upwards of a week. And now that we're sending to this other laboratory, we can get the tests out, within a few hours after that the swab has been collected, and then typically results by the end of the night.
The purpose of this episode is not to highlight how underprepared healthcare professionals initially felt in responding to a pandemic. Instead, it's to note how quickly our community responded to get ahead of the curve. As Justin mentioned, his lab quickly found a way to turn a 3-day testing process into a less than 24-hour one. Lindsay felt St. Luke's was doing everything in its power to protect its staff and its patients. She also mentioned pride in Ohio Governor Mike DeWine and the director of Ohio Department of Health, Amy Acton, both forces in creating early closures, quarantine measures, and reminding people to stay safe, wash their hands, don't touch your face, essentially flattening the curve of COVID cases here in Ohio.
I just think if we all kind of work together like we are, like you said, Ohio is flattening the curve, which is great news. It's like we will get through this if we listen to, what the CDC and Mike DeWine is telling us to do. We will get through this, but it's just the longer people aren't abiding by these recommendations, the longer it's going to be that we're going to have to keep doing it. So I appreciate everyone who has followed these guidelines and stayed at home, and it really is making a difference. So just keep it up, because, hopefully Ohio will continue to keep flattening that curve, and we can maybe inspire other communities. And I do think that people are coming together just, to support each other, and which is just really nice and during this scary time.
As we close this episode, there's one last important note to make. Although Lindsay is thankful for the recognition nurses are receiving during this time, she also wanted to give credit to the other individuals heading into the hospital every day. That's respiratory therapists, environmental services, cafeteria staff, nursing assistants, individuals who work on the front lines alongside nurses and doctors, creating a community where truly no one is fighting alone. For now, I'm Haley Taylor, and thanks for listening to this episode of the Rough Draft Diaries.